Well, my name is Allyson Lange-Sost. I am a licensed acupuncturist. I'm licensed in Florida and Georgia. I'm also a biomagnetic pairing therapist. I've been in medicine for over 30 years. I was a respiratory therapist for almost 17 years before I got into acupuncture.
Can you describe what is acupuncture?
Right. Well, acupuncture is needling specific areas along the body to elicit a response. And that can be a physical response. It can be mental, emotional too. We don't really separate the two. And the way I try to explain this to people is that the body has its own intelligence, right? It already knows what to do, or else we would have all been dead a long time ago. The symbol for that intelligence is pronounced chi. And this chi flows throughout the body on its own pathways, just like the cardiovascular system has a pathway, the nervous system has a pathway. This energy, this intelligence, this chi also has pathways along the body. We call them channels or meridians. And there are main channels and meridians that are associated with major organ systems like bladder channel, lung channel, liver channel, etc. And then there are little connecting channels along the way. And they coordinate all your body's functions. So it's up to us as acupuncturists to decide what channel do we need to tap into and what point along that channel
It's the most effective.
is the most effective for what we're trying to do.
That sounds pretty complicated to me.
It takes
Just
a little
saying.
while to, yeah, right. That's the quick answer to what is acupuncture. But yeah, it takes a long time to learn this and to learn it well and to be safe and effective.
How long does it take you?
It's a minimum of a master's. So the program I went to was over 3,200 hours. It's 10 semesters and we go back to back. So it's 40 months. So it's pretty intense.
That's an intense.
Yeah. And we have a specific number of patients we have to see. And then there are 4 national board exams.
So this is not just, a weekend course
Yeah.
that you take and are ready to stick needles in people.
Not safely.
Right.
Not safely. Right. Yeah. No, it's intense and it's meant to be that to,
Yeah.
keep the integrity of what it is we're doing.
Yeah, I think that's important to understand that acupuncture is a healing method that is very involved and is almost comparable to our Western medicine. It's a different approach, is that right?
Yeah, definitely. It is a medical practice in and of itself. And I feel like it complements other practices as well. One of the things that my mentor and one of the founders of the college, Dr. Hammer, would tell us is that all practices of medicine are valid and all are incomplete. So people have complex lives. Human beings are complex and, usually a multi-pronged approach is great.
Exactly.
And when you can work with the body's own intelligence and help it to do what it already wants to do anyway, I think that's great.
So that almost is like starting at the foundation and open up the body to the healing path.
Right.
Yeah.
Right. In a natural way.
I like that. I always did, and but I think it's important to understand that acupuncture is a very complex system and a very complex method. So it's not just, I go to the acupuncture one time and I'm fixed.
Right.
How many sessions do you recommend?
Yeah, that's the question everybody wants the answer to.
Yeah.
And it's hard to answer until I meet with that person. With me, your initial appointment is, we're going to talk about what brought you in, and then I'm going to do a head to toe assessment. And that helps me find patterns. It kind of depends on what brings you in. If pain is involved, often I recommend weekly treatments, usually 3 to 4 weeks, and then we can start backing away doing every other. Most of the time people come every other week. So it really just depends on what it is they're seeking treatment for. And I always say the number one thing is being consistent. Right next to that is frequency. Frequency is going to get you to your goals faster.
Right.
So, but it's got to make sense, for everybody.
Right, and I mean, make sense in what is your outcome, the goal of it all.
Right.
And then, of course, the financial aspect of it too.
Yes.
And I mean, that needs to be considered.
So your goals, your time, your money, it all needs to make sense.
Exactly.
Yes.
Going back to, you said in the beginning, acupuncture dry needling, that this is pretty much the same thing. I know from my own experience, people come to me and say, my physical therapist, they did dry needling, and some people say that worked, and some people say it didn't work. Can you explain a little bit is it the same as acupuncture? Is it different from acupuncture? I mean, they are using the same needles, right?
They are. So the American Medical Association has looked at this and said there is no discernible difference between dry needling and acupuncture.
Interesting.
We're both using needles, the same type of needle, and we're needling into the body to elicit a response, right? Typically with dry needling, it is a trigger point stimulation, and it's what we would call, most acupuncturists would call, it's a lifting and thrusting technique. So it's strong stimulation of the needle in that area, and there's no needle retention. Whereas with acupuncture, we might use that technique in a specific area, but we're also going to open up those channels, those meridians of communication, because it's rarely ever just right here, in that one spot where the trouble is. So we're going to use needles in other places and use different techniques.
Can you do dry needling?
Absolutely. I do. For a long time, I didn't call it that, but it's a term that people are familiar with.
And I almost want to say with way more experience than most physical therapists have, because you already do that as part of acupuncture.
It's part of our training. And the comparison is that any acupuncturist is going to have a minimum of a master's degree. And physical therapists, as of right now, only need 50 hours of training to do dry needling.
So I would go to an acupuncturist. Just
saying.
saying.
I back that up.
Yeah.
There are some areas when I'm needling you that may be more sensitive just because of where they're located. And sometimes those points are what I say active. So there may be more of a response as I needle, but it should, settle down, and you should be able to relax on the table and take a little acu-nap. I find if you're relaxed on the table, the needles are going to do their job. They're just communicating with one another and coordinating and kind of helping to redirect what's going on. And if you're in a relaxed state, that's going to happen more easily. And take a little acu-nap. I give a discount for snoring.
I mean, that's the favorite part of me. I think every time I get a acupuncture treatment, it's not so much that I'm falling asleep. It's I'm in a state of in between. I'm not wide awake, but I'm not full asleep.
Right.
But after, I feel like yes, the rest of the day, or I feel refreshed. I feel relaxed.
Right. And people come to me, they want more energy, and a lot of times after a treatment, they'll have a little dip in energy, and I just remind them if they'll honor that, the energy you're seeking will come.
Right.
This is just your body kind of getting ready. They say
I think
an arrow doesn't fly until the bow is pulled backwards, right? So sometimes you have to go back for just a minute, and then that energy will come.
Going back to that we are educating our clients or patients often about our wonderful innate capability of our bodies to heal themselves if given the opportunity.
Enough time in the right circumstances, our bodies will heal themselves.
Yes.
And I think a lot of times they don't get that from their medical doctors.
No.
I see people all the time, well, this is just what it is. You're just going to have to learn to live with it. And that's unfortunate, because in my practice, what I've seen is that everyone gets better. Now, the degree to which they get better depends on all kinds of things, right? Where they were when they came in, what they're dealing with, what their lifestyle is. We can do great things here, but if you have a question, can acupuncture help with this? The short answer is yes. Yes, it can. I had a lady that came to me. It was she had fallen at work and fractured her foot and her ankle. She had had 8 surgeries. She had done prolotherapy, she had injections, physical therapy. She had done everything that they knew to do for her, and they were going to fuse her joint, which was going to ripple into all kinds of other issues, right? When she came to me, she asked the doctor, could I try acupuncture? And I said, well, sure, it's not going to hurt, but I don't have any big expectations. So she comes in, with crutches.
Oh, wow.
She either used crutches or a walker, and on a bad day, she was in a wheelchair. And even at work, just going down the hall to the bathroom, just kind of depended on what kind of day she was having. So because it was an injury at work, her doctor had to write an order for it every 6 months. And every 6 months she would go back, and he would measure her range of motion. Now, I saw her for 10 years, and every 6 months she went back, her range of motion improved. And every single time he, well, I don't expect any more changes. Well, this was good. And so that was always our joke.
Right.
Yeah. But she takes dancing lessons with her husband now.
That is amazing.
Yeah.
I mean, she got her life back.
She got her life back, 100%. So yeah, and that's the beauty of acupuncture, is that we take the whole body into consideration. And when we treat the body as a whole.
I think that's a very comforting thought, that you can go to somewhere and they look at you as a complete human being and not just a leg. Well, I'm super excited that you're here, and
Well, thank you. I'm excited to be here. I
Good.
really am. I appreciate the opportunity and
absolutely.
love this area, and being here is just, it's so comfortable and really feels like a healing space. So I'm really happy to be here.
Oh, thank you.